Bismillah Rahman Rahim. Today we talk about the diseases of the salivary glands. The salivary glands, the two important lesions that occur in the salivary glands are the inflammatory lesions and the neoplastic diseases, uh, and which are very important in relation to the diseases of the salivary glands. The salivary glands actually they are exocrine glands. By exocrine we mean that the secretions of the salivary glands are carried in the ducts, like the pancreatic secretions which are carried into the duodenum in the ducts. In comparison, the endocrine glands they secrete their contents directly into the blood circulation. For example, they secrete hormones which are carried direct in the blood circulation to the target organs. The three major glands are in pairs, and the parotid glands which are situated in front and beneath the ears, they secrete about 20% of the serous saliva. And the parotid glands are important because the facial nerve pass through the parotid gland, and uh, more the parotid glands are the common targets for the viral infection like mumps that occur in children. The submandibular glands are situated deep in the mouth, uh, below the mandible, uh, and they secrete about the 60% of the mixed saliva. By that we mean that the saliva is serous as well as mucinous. The sublingual glands, which are situated below the tongue, supply the secretions mainly to the floor of the mouth, and it secretes about 5% of the saliva, which is mucinous, and the around in the oral cavity there are uh, hundreds to thousands of the minor salivary glands. The salivary glands are innervated by the parasympathetic and sympathetic arms of the autonomic nervous system. The parasympathetic stimulation causes salivation and increased secretion of the saliva. Now, anatomically and histologically, each salivary gland is composed of acini and ducts. The acini are located at the terminal position of the ducts, and they are connected to the duct system, and the acini they are lined by the single layer of cuboidal epithelial cells. Now talking about the human saliva, it is about 99.5% water, and it contains the digestive enzymes, for example, the lingual lipase to break down saturated fats, and the salivary amylase known as the tyline, which break down the carbohydrate starches into maltose and dextrins. The mucin, which is a glycoprotein, it lubricates the food. The immunoglobulin A, which is contained in the saliva, it has got an antibacterial and antiviral actions, and the uh, lysozymes and lactoferrins, which are contained in the saliva, they are antibacterial and they will attack the bacterial wall and uh, provide an immune protection to the person. The inorganic substances which are contained in the saliva are sodium, potassium chloride, and bicarbonates. The content of the saliva in the form of electrolytes, it is important because in situations these electrolytes like calcium, phosphate, and other electrolytes they can precipitate and can form stones, a condition known as the sialolithiasis. Normally, in the human saliva, there is no glucose, but in patients of hyperglycemia, particularly those who suffer from diabetes mellitus, they may have glucose in their saliva. Now, lesions of the salivary glands, we divide lesions of the salivary glands for our convenience into inflammatory lesions and functional lesions, and number three, neoplastic lesions. The inflammatory lesions of the salivary glands are in the form of inflammation known as the sialadenitis. Sometimes Uh, the salivaritis may be in the acute and chronic form. Mucocele, which is a localized collection of uh, saliva uh, in a cavity, which results from rupture of the salivary duct, is also important. The autoimmune diseases, particularly the Sjogren syndrome, in addition to other organs of the body, also targets the salivary gland, particularly the parotid gland. The functional disorders of the salivary glands may be in the form of xerostomia, which means decreased production of saliva, and it may be in the form of siluria, which by which we mean increased production of the saliva, and mostly these are components of a disease. The neoplastic conditions that occur in the salivary glands may be in the form of benign tumors like pleomorphic adenoma and other rare tumors, and the very important malignant tumors, mucoepidermoid carcinoma, and sometimes other rare malignant tumors. Now, first we discuss the functional conditions of the uh, functional disorders of the salivary glands. The xerostomia, we mean decreased production of saliva, and which causes a dry mouth. And mostly this is a presentation of other diseases. For example, it may be a presentation of the Jagran syndrome. This dry mouth and decreased production of the saliva can also be caused by radiation therapy, and there are medicines, for example, anticholinergics and antidepressants, as well as diuretics, which can cause dry mouth and decreased production of the saliva. Now, the dry mouth uh, promotes the fissuring and ulcerations in the oral cavity, and automatically these situations will lead to difficulty in swallowing, speaking, and they provide a field for the fungal infections like candidiasis, and they also favor the formation of dental caries. Now, first we discussed the inflammatory condition known as the Sera Tinnitus, which means inflammation of the salivary glands. Now, inflammation may be caused in the salivary gland by infection with viruses like mumps, and it may also be caused by bacteria. The most important are the Staph aureus and Streptococcus viridans, and the autoimmune condition Sjogren syndrome is very important in causing salivaritis, and sometimes the inflammation of the salivary gland may be related to some traumatic injury. Now, by Sera we means inflammation of the salivary glands. Now, we can get this inflammation in its acute form or in its chronic form. The acute form mostly affects one gland, and it is common in 50 to 60 years of age, but it can occur in any age, and even it can occur in a newborn. Now, the acute salivaritis, it is favored by the formation of stone known as the pyelolithiasis. And this stone formation in the salivary duct occurs due to precipitation of calcium, phosphate, and other electrolytes. And this type of stones or pyelolithiasis is most commonly associated with conditions which lead to decreased flow of the saliva. Now, acute salivaritis may be caused by bacteria. The most common bacteria involved are the Staph aureus, Streptococcus viridans, and the Haemophilus influenzae. Acute salivaritis may also be caused by viruses like mumps, particularly in children, and human immunodeficiency virus, which causes AIDS. Now, coming to the chronic salivaritis, the chronic salivaritis is associated with prolonged conditions of decreased salivary flow. Now, it may be the result of either repeated episodes of acute inflammation, or it may be caused by the autoimmune disease, particularly the Sjogren syndrome. Now, the repeated episodes of acute inflammation and the Sjogren syndrome, they lead to chronic inflammation. And as we know that Compared to the acute inflammation, in chronic inflammation, we may get scarring and healing process. And what is the result of the chronic inflammation? That it will lead to fibrosis of the salivary ducts. When the salivary ducts are fibrosed, when their walls are thickened, automatically the saliva cannot quickly flow through it. And it will be slowly uh, flowing through these ducts, and which the saliva becomes more viscous, and it provides a chance for the uh, happening of the chronic inflammation in the glands. Now coming to the sign and symptoms of silidinitis. Uh, in acute silidinitis, there is usually pain, and if it occurs in the parotid gland, the gland may be tender, uh, it may be swollen, and we can see the redness over the skin due to inflammation and increased blood flow and vasodilation in the blood vessels. So, pain, swelling, and redness over the skin may be the signs include these signs are included in the sign and symptoms of the uh, silidinitis. And automatically, when the gland is inflamed, there will be less production and secretion of saliva, and if when it is infected, particularly by the pyogenic bacteria, the patient may complain of very bad taste, which comes from the pus, and there may be foul swelling. The patient suffers from pain when he or she opens the mouth, and this situation leads to difficulty in eating, drinking, and even speaking. As compared to the acute silidinitis, in chronic silidinitis, the signs and symptoms are less prominent and slowly and gradually develop. They are more prominent during an acute episode of acute silidinitis during the course of the chronic silidinitis. Now, bacterial infections, viral infections, injury or trauma to the salivary glands, the autoimmune Jagran syndrome, and dehydration. They will cause the saliva more concentrated and viscous, and automatically it will lead to the reduced flow. Normally, the quick flow of the saliva when there is no abnormality or no pathology in the salivary glands or in the ductal system, it will lubricate the mouth, it will start digestion of the carbohydrates through the salivary amylase. The salivary amylase is different from the pancreatic amylase. Moreover, the mucus content in the saliva, it will moisten and softens the food, and the saliva contains the immunoglobulin A antibodies, and also lysosomes, lactoferrins, and all of them, they kill bacteria and have their antibacterial effects. Now, when the salivary secretion are less, or if there is ductal problem which leads, for example, ductal fibrosis, which leading to the reduced flow of the saliva, it will allow deposits on the duct walls, particularly the calcium, phosphate, and other electrolytes that will precipitate there and form tiny stones, and this condition is known as the syelolithiasis. And once the stone is formed in a duct, it will favor the growth of the bacteria, for example, Strep aureus, Streptococcus viridans, and Haemophilus influenza, and it will lead to the acute inflammation of the gland in the form of acute silidinitis, which is particularly painful and which appears red and swollen due to inflammation. Now, how to diagnose silidinitis and how to treat it? For the diagnosis of the salidinitis, clinically we can see, for example, the parotid gland, it is swollen, and we can milk the gland to get the secretion contained in the gland, and we can examine it in the microbiology uh, laboratory, and by making a culture of it to find out the causative bacteria and which will facilitate the treatment. Sometimes we can take x-rays and other imaging techniques if we suspect abscesses and if we suspect the presence of salilithiasis in the form of a salivary stone, and if we suspect tumors that may occur in the salivary glands. Now, the treatment of Sera Tinnitus is hydration, to provide sufficient water, and we can do gentle and uh, gradual massage of the glandular tissue to stimulate secretion of the saliva, and we will use antibiotics to treat the infection. Uh, uh, as long as we have no culture report of the bacteria, we can put the patient on broad spectrum antibiotics, and we can also use the medicines that increase salivary secretions, but they should be used with care, and the side effects they should be taken into consideration. When all these measures fail, what we do, or if we suspect that the condition may not lead to a tumorous situation, the production of a tumor, benign or malignant, we can remove the, for example, if the parotid gland is involved, we can do partial or total removal of the gland according to the situation in which we are dealing the disease. Now, coming to the summary, uh, we said that salidinitis is the inflammatory condition which involves inflammation and swelling of the salivary glands. It may be in its acute form, which is typically caused by Staph aureus, but also by Streptococcus viridans and Haemophilus influenza. And the acute salidinitis is particularly established when the salivary duct is blocked by a stone, which is formed by the precipitation of calcium phosphate and other electrolytes uh, in certain situations, and which gives rise to the condition known as the salilithiasis. In comparison, the chronic uh, silidinitis, which is related to the decreased flow of the salivary secretions as a result of the fibrous tissue that is formed in the salivary ducts, and which becomes narrow, and there is decreased salivary fluid due to decreased production, and as well as the narrow salivary ducts uh, may result from repeated attacks of the acute salidinitis, and more often it is associated in the autoimmune disease, particularly the Jagran syndrome. Now, here we will briefly discuss an overview of the conditions, inflammatory conditions that occur in the salivary glands. The mumps, which is caused by the mumps virus, which is an RNA virus, and which infects the nasopharynx, causing viremia. By viremia means when the virus circulates in the blood. And here we remember that the mump virus belongs to the family, which also include the measles and the para-influenza viruses, which are very important. The mumps, actually, it is an acute self-limited systemic viral illness, right? The involvement of the salivary glands is a part of it, and it commonly affects the children, and the disease spread through respiratory droplets, which can commonly infect the nasopharynx, and later on when the virus replicates in the infected cells and the cells rupture, the viruses come out and they circulate in the blood. And remember that this is a very extremely contagious disease. This is a normal happening that in a street or in a combined house, when one child is infected, within days the other children they get infected, and therefore it is extremely contagious. The diagnosis of the mumps can be made through serological examination, which shows the antibody response. We inject antibodies, and if the antigen is present, it will give a positive result. The mumps, it is actually a self-limited disease, but sometimes if it is complicated by respiratory tract infections, for example pneumonia, and severe upper respiratory tract infections and gastrointestinal tract infections, like, for example, in the form of diarrhea and vomiting, that it will need the appropriate treatment. Otherwise, it is a self-limited disease, and if the child is immunocompetent, he will recover soon. For the prevention of the mumps, we have vaccines available in the expanded program of the immunization EPI, and these vaccines are the MMR vaccine, which includes vaccine for both measles, mumps, and rubella, and they are the live attenuated vaccine, by which we mean that they contain the weakened uh, uh, viruses, and which can be antigenic. By that we mean that they will produce the and activate the acquired immune system, but which is not pathogenic. By that we mean that it will not cause the disease. The first dose of the MMR vaccine is usually given between 9 to 15 months, and the child may receive a second dose uh, in the area between 15 months and to 6 years, which is known as the booster dose. Now, in addition to the salivary glands, particularly the parotid gland, the mumps virus also uh, infects the testicular tissue, epididymis, central nervous system, kidney, pancreas, heart, and joints. Here, we talk about particularly the testicular tissue, which later on may lead to infertility problems. Now, coming to the uh, we make a brief review of the Jagran syndrome, and actually it is manifested by severe dryness of the mouth. And what happens, that this is an autoimmune disorder when our immune system developed an immune reaction against the self antigens, lacking self and non-self differentiation. So when the immune system reacts against the self antigens, there is autoimmune destruction of the exocrine glands, like salivary glands, pancreatic glands, and so many other exocrine glands are there in the body. And what happens, that the activated CD4 T cells and B cells producing antibodies, they attack the exocrine glands. The Sjogren syndrome is typically common in the middle-aged female, and it is the result of an interplay of the genetic disorders and also depends on the environmental conditions. The primary Sjogren syndrome, which is known as the Seka syndrome. So, the Sjogren syndrome may occur singly in the form of Seka syndrome, or it may be associated with other autoimmune diseases. You remember that in relation to the autoimmune diseases, when we see one autoimmune disease in a person, we must seek for other autoimmune diseases also, because a person who is targeted by one autoimmune disease is susceptible to be attacked by other autoimmune diseases. So, if the Sjogren syndrome occurs singly, simple, then we call it as the Seka syndrome. But if it is associated with other autoimmune diseases like rheumatoid arthritis, then we call it as the secondary. The common targets of the Sjogren syndrome, which involves autoimmune destruction of the glandular cells, are the lacrimal glands in the eyes, lack of lacrimation, and the condition is known as the keratoconjunctivitis. It may uh, affect the salivary glands, with leading to severe dryness of the mouth, and it may also affect the nose, larynx, the skin, sebaceous glands, and the vagina, which will lead to dryness of these organs. The Sjogren syndrome is diagnosed by salivometry, in which we measure the flow of the saliva, but which is a rare test, and the blood tests, in which we look for the anti-Sjogren syndrome A and anti-Sjogren syndrome B antibodies. And you remember that these tests are not specific, because the same antibodies, the Sjogren syndrome A and Sjogren syndrome B, they are also present in other autoimmune conditions, for example, systemic lupus erythematosus, and therefore we say that they are not specific. We may take a biopsy from the infected exocrine gland, and we will see numerous activated CD4 T lymphocytes, as well as plasma cells, macrophages, and we can see severe thickening and fibrosis of the inner ductal walls. The We treat autoimmune diseases by using the immunosuppressants in the form of steroids and other drugs, and we may also use the drug pilocarpine to increase the exocrine secretion. Now, coming to the conclusion, the Sera Tinnitus, which is inflammation of the salivary gland, is the most common form of Sera Tinnitus is mumps, which may produce enlargement of all the salivary glands, but particularly the parotids, which are larger glands, and they produce interstitial inflammation, which is uh, characterized by mononuclear inflammatory exudate. By what we mean that there is inflammation, there is infiltration of the mononuclear cells, plasma cells, lymphocytes, and other mononuclear cells. And in adults, it can cause pancreatitis or architis, uh, which is infection and inflammation of the testicular tissue, and the architis may later on manifest itself as the sterility, and the problems of infertility may become the issue. Bacterial cellulitis, which particularly involve the submandibular glands, and it is caused by Staph aureus, Streptococcus viridans, and Haemophilus influenza. And the predisposing factors for these conditions are the duct obstruction by stones and dehydration, uh, which lead to decreased secretion of the saliva, and many drugs also suppress the salivary secretion. The Jagran syndrome is a chronic systemic disorder, and it also involves the eyes in the form of keratoconjunctivitis and dry mouth, and it results from immune mediated destruction of the lacrimal gland in the eyes, salivary glands, and other glands. Now, the mucocele, it is a cyst-like space which histologically we can see, which is lined by granulation or fibrous tissue. In its acute form, it may be lined by the granulation tissue, or in its chronic form, it may be lined by the fibrous tissue. And it is filled with mucin. And we may also see inflammatory cells. In acute conditions, there may be neutrophils, and in chronic conditions, there may be mononuclear cells, uh, plasma cells, macrophages, and other chronic inflammatory cells. And how mucocele develop when there is uh, obstruction in the salivary duct? What happens that the gland becomes filled with with secretions, and it may get ruptured. The rupture can also be occurred by other conditions. It may be traumatic or due to other reason, but the most common reason is the blockage. And what happens that now when the gland is ruptured, the saliva leaks into the surrounding connective tissue, and it will form a fluctuant swelling. Particularly, this condition is more common in the lower lip. It may resolve itself, or sometimes it may need treatment. Thank you very much.